Well, tonight, 7 News is on your side with a groundbreaking surgery taking place right here in our area. This new technology uses a robotic arm to increase accuracy and improve recovery time. And it's getting rave reviews from patients with back pain. A night out bowling may not seem like something to celebrate, but for 57-year-old Brian Royal, for decades, he couldn't do this, all because of his bad back.
Being military, trying to be tough, you start gutting it out, ibuprofen, everything else, but the pain never actually went away.
It started 30 years ago when Royal was in the Air Force, stationed in Florida.
We ended up getting hit by a drunk driver, and me being active duty military, I was rushed to a Air Force base.
Over the years, he tried it all, but the back pain just got worse as he aged. The walking tours he has to lead at work were a real struggle.
Everybody else is just walking and talking, and I'm thinking to myself, holy smoke, somebody please, let's get a cafeteria, find a chair, find me a wall to lean on.
Then in February, he met Dr. Edward Alisi of MedStar Washington Hospital Center, who is the first in the country to use the Circ robotic arm for spine surgeries.
The Circ robotic arm is the first one in the Western Hemisphere. At the time we got the robot, there were only 2 other devices in the world.
Dr. Alisi says the robotic arm technology cuts down on surgical and recovery time and dramatically increases accuracy. Just ask Brian Royal if it worked.
You come out of the surgery.
Hallelujah. Hallelujah is the word. From the time I woke up to now, I've never had pain again.
Dr. Alisi used the robotic arm to correct Royal's spine and stabilize it in the correct position with screws and rods. Dr. Alisi has now done almost 100 of these robotic arm surgeries at MedStar with a 95% success rate. Dr. Alisi says we're just scratching the surface with this technology.
How often would you say that people are as pleased as Mr. Royal?
Well, it's interesting because our success rate over such a short period of time has been outstanding. I've been doing this for over 35 years.
Thank you. Thank you. Thank you. I'll never be able to thank you enough.
You know, and often people with back surgery have to have more surgeries down the road. In fact, that's about 20 to 30% of the time. But MedStar says because of how accurate the robotic surgery is, reoperation rates drop down to just 5%. And John, you know, both of these men wanted me to pass along to everyone that it's okay to take care of yourself. You don't have to always gut it out. Right. And there are other options, even if surgery is not the answer for you. And so we did put a long list of things on our website on WJLA.com of things you can do to treat chronic pain. But the real moral of the story here, regardless, is to ask for some help.
Yeah, no question. And there's nothing worse than chronic pain.
Exactly.
And you don't want to mask the symptoms with drugs and other things. You want to deal with the issue.
Yeah,
All
exactly.
right, good stuff, Allison. Thanks. Well,